Hello, and welcome to the Dr. Shelley Meyer YouTube channel and the Women in Medicine Be the Change podcast. I'm here with Dr. Nora Vasquez today, and we're going to have a great conversation about her experiences with burnout, but then how she turned that into helping other healthcare providers and physicians with burnout. So there's a silver lining there. So Dr. Vasquez or Nora, it's great to have you here. Tell us a little bit about your experiences yourself. And then a lot of us are driven when we make these changes in our career. We're driven by something personal and a personal experience we've had. So we'd love to hear about that. And then, your training and what you're doing now.
Yeah, well, I'm just honored and excited to be here with you today. I think what you're doing is amazing. So yes, I'm an advanced certified physician coach, and my pathway to what I'm doing now was my own personal story of burnout. I'm an internist. I, was the first in my family to go to college, first to go into medicine, and really pursued my passion of helping the underserved, working in federally qualified health centers and in urban communities, and loved what I did and loved my patients. But, when I look back, I noticed there were times when I was feeling burnout and I didn't even know it. And I think that's what's so shocking is, now we talk about it so easily, but back, a decade ago, we weren't really talking about burnout. And, we're all just trying to do the best that we could, but realizing that, that there were sacrifices that sometimes we had to make, and especially as women, and with families and trying to do all the things. And so, I'd say several years ago, it kind of, my burnout really came to a point where I knew I needed to do something, and I knew something had to change. I just didn't know what or how to go about that. And that's when I found coaching. And coaching was such an amazing experience for me because it really helped me figure out my next steps and with these simple tools. And once I, felt more agency and possibility and that I could change my circumstances in a way that was meaningful, I was like, all my colleagues need to know about this. This is amazing. And yeah, it really just kind of opened up my world because we kind of get into medicine. We think there's only one way to do medicine, one way to be a leader, one way to rate, and the truth is there's so many ways that you can design your career life, work life, family life in a way that works for you. And that was so exciting to me.
And just realizing that you have that control, you can regain that control. It doesn't have to be given up, and you can do what, you have opportunities, right?
100%. And so it inspired me to go for advanced certification and to become a coach myself. Mm-hmm. And, over the last several years, I've been able to coach hundreds of physicians, healthcare professionals, nurses, physician assistants, at hospitals and medical organizations, institutions, in a group coaching program and also one-on-one. And it's been an amazing experience to really help empower other professionals to really create a life that is fulfilling and help them overcome the burnout and really feel more empowered day to day.
Yeah, and so important. And I'm inspired and hopeful that more will do so, but I like the fact that institutions are reaching out to you in hospitals. That's good. That's exciting. So how does that work? You meet with the administrators, you meet with the whole team. How do you structure it usually?
Yeah, usually, from some of the work I do, people will reach out to me and say, hey, I'd love to bring coaching to my institution. Okay. I'd love for you to, maybe talk with my admin, my CEO. And so then I set up a meeting oftentimes with the administrators and present them, all the results that I've been able to accomplish for my clients, and they're blown away. Once they see, I use survey tools to kind of show to what degree their staff, their physicians, their physician leaders are burned out. Mm-hmm. And then, after working with me in my coaching program, I show them the results of the Maslach burnout inventory and showing them, that people that were burned out are now engaged. People that, thought that they were going to leave their institution and medicine have reconsidered. And so it's improving their retention. It's improving their leadership the way that their medical teams can work together and find more harmony. So those kind of testimonials, one by one, and then also in a group, are showing, the CEOs that, wow, this really does work. And it's actually providing a support and community system for their leaders who want to stay in medicine. Many of us, we love what we do.
Right.
It's just trying to find a way to make it work.
Yes.
And in a way that doesn't leave us burned out at the end of the day, that really fulfills us. And then we learn skills on how to communicate better, how to lead better, how to put in some healthy boundaries. So that way you feel rejuvenated at the end of the week instead of completely, burned out.
Yeah. Do you feel like it's the technique you're using is reproducible with small and large groups, or it is? Good.
Yeah, 100%. Over the last several years, I've been working with, hospitals in rural areas, hospitals in urban areas. I've been coaching individual physicians all over the United States and Canada. And, once they come into my program and we do some one-on-ones and we do some group coaching, and I teach strategies and techniques on simple things that they can implement today to help make their day-to-day easier, more manageable, more fulfilling. There's no one that I've worked with that hasn't had a positive experience or learned something. And so, that's reflected in their testimonials. That's reflected in the Maslow Burnout Inventory survey that I do.
Evidence-based, data to go to and to not only, help you navigate your development, but then bring it to others and show just, we all like evidence-based medicine to show how much it works, right? Yeah. That's so fun and awesome and amazing. And I'm glad that there are not only individuals seeking this out, but the people that the individuals might be working for or working with too, because we got to change the structure and from the administrative aspect as well. Awesome. So do you do the same kind of, like if you're working with an individual, is there kind of a set duration, or that may, just like any other kind of individual relationship, go on for, whatever period of time is needed? But with the group setting, is it a certain time 2 weeks or, 2 days? Or how does it work?
Yeah. So I've done various, I've worked with one-on-one individuals, for 8 to 12 weeks, 6 months. And, through my experience, what I've seen is, once you learn some of these strategies, there's always something that you can always add to your life, different avenues that you want to pursue. So many of my clients continue to want to work with me one-on-one. But what I've developed, over time is a 6-month coaching program, which I'm going to be launching in September, which I'm really excited about, September of 2022. And this will be an opportunity for hospitals and also individual physicians or healthcare professionals, nurses, CPAs, or not CPAs, but nurses, CRNAs, any kind of healthcare professional can join my program. It's for 6 months, and each month there's a theme that we talk about. So the first month, we're going to talk about efficient charting, how to get our work done at work so we can have more free time at home to do the things that we love.
Right.
And then the next month, we'll have a different theme, a different guest speaker come in, and then I'll be coaching and really helping guide that journey, that transformation month by month. And over a virtual Zoom where we can, come together, create community and support one another. And so that'll last for 6 months. And then people, if they want to continue, they can still continue. And if not, then, they now have some tools that can really empower them.
That's great. And I like that there could be a variety of participants. Everybody can learn from each other's experiences. We don't necessarily learn as much when we're just in our own niche. So it's nice to have participants from across healthcare, whether they be the actual physician or other supportive healthcare providers, or other healthcare providers are doing their own thing. And you said administration too?
Yeah, well, admin supports this, but in our group coaching, I'm really sensitive to the fact that creating a safe space. So I'll have coaching calls just for physicians and a coaching call for other healthcare professionals. Admin, they're able to kind of see what we're learning, but those small groups are really exclusively for the clients.
Yeah, I think that makes sense. It's better structured. You do need that safe space, and you need to be able to share openly, or then you like your work if you can't do that. Great. That sounds really interesting. So how can everyone listening or watching find out what you're doing and find out about that program that's coming up?
Yeah, 100%. So they can go to my website, www.renewyourmindmd.com. And I'll have a link there where they can get on my wait list. I'll have some resources that are free and available to them if they'd like to learn more about coaching, or if they want to reach out to me, they can also email me at renewyourmindmd@gmail.com. And I'd be happy to talk with them over Zoom and see how I can better support them wherever they are in their journey, whether they want one-on-one coaching, or if they want to bring coaching to their institution, or if they want to join my coaching program. There's so many ways that they can really benefit from these resources, and 100% it will totally improve your life and really up level it. So that way, you don't have to suffer burnout and kind of get stuck, and like, is this it? There's so much more out there. Yeah. You can have the life that you want and love and fall back in love with medicine again. By just, implementing some of these strategies that are really simple, but are so effective in really creating the life that you love on purpose.
That's a great message to end with. I think that's what we all are seeking. And just when you are happy with your work, which is what you spend most of your life doing, it seems, especially in medicine, then you're happy at home. And then, when you can balance your work life, then you can enjoy your family. So such a great message and such a great intervention, I think, that people can find in this kind of coaching. So I will post your contact information in the description and in the show notes so people can reach out to you. And I thank you so much for telling us about what you're doing. And I thank you for all you're doing. It's been great to talk to you today.